This tablet is used to treat a specific bowel disease called ulcerative colitis. It helps reduce symptoms such as diarrhea, rectal bleeding, and stomach pain. It is best to take this medication as prescribed by your doctor. Before you start taking Etrasimod, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. Take this medication by mouth as directed by your doctor, usually once daily. You can take it with or without food, and make sure to swallow the tablet whole. To get the most benefit from this medication, use it regularly. Try to take it at the same time each day to help you remember. It's important not to increase your dose or use this drug more often or for longer than prescribed. Doing so will not improve your condition any faster and will increase your risk of experiencing side effects. If your condition does not improve or gets worse, make sure to inform your doctor. Some common side effects of taking Etrasimod 2 mg tablet may include headaches, dizziness, or lightheadedness. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they have judged that the benefits to you are greater than the risk of side effects. However, it's essential to monitor your blood pressure regularly as this medication may raise it. Also, be aware that Etrasimod may cause your heartbeat to temporarily slow down, especially after you take your first dose. In very rare cases, Etrasimod has been known to cause serious liver disease. If you experience symptoms such as nausea or vomiting, loss of appetite, stomach or abdominal pain, or yellowing of the eyes or skin, contact your doctor immediately. Additionally, be on the lookout for any unusual skin changes as this medication may rarely increase the risk of skin cancer. While taking Etrasimod, your ability to fight infections may be lowered, making you more susceptible to serious infections. It's important to seek medical help if you notice any signs of infection, such as a sore throat that doesn't go away, fever, chills, or painful/burning urination. Furthermore, there is a rare but very serious risk of a brain infection called progressive multifocal leukoencephalopathy, PML, while taking this medication. Seek medical help immediately if you experience symptoms such as clumsiness, loss of coordination or balance, weakness, sudden changes in thinking, difficulty talking or walking, or seizures. Finally, if you experience any very serious side effects such as shortness of breath, irregular heartbeat, severe dizziness, unusual tiredness, eye pain, or a severe headache, seek medical help right away. And in the rare case of a serious allergic reaction, including symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek immediate medical attention. It's important to note that these are not the only possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. If you experience any side effects, it's crucial to seek medical advice and report them to the appropriate authorities. Before taking Etrasimod, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before using Etrasimod, it's important to discuss your medical history with your doctor or pharmacist. This includes any breathing problems, infections, diabetes, eye problems, fainting, heart problems, high blood pressure, liver problems, skin cancer, stroke, or mini-stroke. Etrasimod may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. Limiting alcoholic beverages and discussing marijuana use with your doctor is also advisable. This medication may make you more susceptible to infections, or worsen existing infections. It's important to stay away from people who have contagious infections like chickenpox, COVID-19, measles, or the flu. Discuss any potential exposure to infections with your doctor. Before starting treatment with Etrasimod, discuss your vaccine history with your doctor. You may need to receive certain vaccines before starting this medication, especially if a live vaccine is required. It's important to avoid contact with people who have recently received live vaccines. Etrasimod may rarely increase the risk of skin cancer, so it's important to limit sun exposure, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Discuss any concerns about phototherapy with your doctor. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. You should not become pregnant while using Etrasimod, as it may harm an unborn baby. Reliable forms of birth control should be discussed with your doctor while using this medication and for 7 days after the last dose. If you become pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. It is unknown whether this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Etrasimod 2 mg tablet, it's important to be aware of potential drug interactions. This means that other medications or products you use could affect how Etrasimod works, or increase your risk of experiencing serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. They will be able to advise you on any potential interactions and help you avoid any negative effects. Some products that may interact with Etrasimod include other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab, as well as fluconazole and rifampin. Always consult your doctor before starting, stopping, or changing the dosage of any medicines while taking Etrasimod. If someone has taken too much Etrasimod 2 mg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important not to share this medication with others. Before starting this medication and while taking it, you may need to undergo various lab and medical tests such as complete blood count, blood pressure, pulse, EKG, eye/skin exams, liver function tests, and lung/breathing tests. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. It's important to store Etrasimod 2 mg tablet at room temperature away from light and moisture, but not in the bathroom. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.